This looks so painful.
An infected hand wound brought this woman to hospital, but she left early, against medical advice. The nurse, now treating her at a supervised consumption site, says the woman felt hospital staff were laughing at her.
They said, "You're a drug user, of course you have an infection."
The nurse is keeping a close eye on the patient, not just for her hand, but for an overdose.
Anytime they've been away and institutionalized, their tolerance drops.
I've left the hospital a few times without my clothing, like my shoes. I had my pants on, of course.
Running out of the hospital in a panic, then overdosing. This man knows the experience well.
It happened about 4 or 5 times here, and it was not a pretty time when it happened.
Someone in the hospital, taking the time to explain where he was and that he was safe, could have helped break the cycle, he says. A new study in the Canadian Medical Association journal suggests people who leave hospital against medical advice are 10 times more likely to suffer an overdose than someone who leaves when the doctor gives the discharge. The study also found those who initiated an early discharge were likely to have a history of substance use disorder.
Before medically advised discharge is an emergency.
An emergency that can be addressed, say the authors of the study.
We need better treatments to keep people in the hospital, and we need to be better at engaging people with a premature discharge from hospital after they leave.
It might be as fast as pull out the IV and walk out the door.
Managing withdrawal symptoms in hospital could also help, says this psychiatrist.
If we underappreciate the impact of drug withdrawal, then the person might get progressively more uncomfortable until they decide to leave against medical advice.
If the patient does decide to leave, researchers say there are still ways to help, like providing a naloxone kit and providing access to sites like this, so even if they overdose, they won't die. Jennifer Yoon, CBC News, Toronto.